Welcome back to What We Do Wednesday. Today I want to talk about an incident that happened over the weekend with one of our clients. This is a care management and power of attorney client. We manage all aspects of her healthcare, and I'm able to make healthcare decisions on her behalf. She had a fall at her community late on Saturday. I got a call early Sunday, Easter, from the hospital social worker with a few questions. When I asked her for more information, she forwarded me to the bedside nurse. Because EMS was called, this client was taken to the nearest emergency room, which happened to be at a hospital she had not been to before, so no portal is set up. Normally, when a client goes to the hospital, we go online and read the chart before we talk to anyone at the hospital. So I'm going into this conversation pretty blind. I knew she had fallen and hurt her hip, but that was all. I asked the nurse for an update, and she told me she was doing well, but that the doctor had not rounded yet. When I asked about her pain, she said she had no complaints. When I asked if the hip was fractured, she told me she didn't know. When I questioned that answer, she said she didn't have access to the test results. I was a bedside nurse for many years, and I can guarantee you I had a complete picture of my patient's health before the nurse reporting to me left for the day. I cannot for the life of me understand how this nurse would not know if my client had a fractured hip. This is an elderly woman who weighs about 90 pounds and came to the hospital because of a fall. I would love to hear from any nurses that could provide some input. But wait, the story gets better. I asked her to have the doctor call me after he rounded. Did I get a call? No. There's more. I go in person to the hospital on Monday morning, and the nurse that I spoke to the day before is there and taking care of my client again. She can now confirm that there is no fracture, but she says they're going to be doing an echo. How did we get from a hurt hip to an echo? She really didn't know, other than her blood pressure was running on the high side. I was trying to give her the benefit of the doubt on Sunday. It was Easter. Maybe she's a new nurse. Maybe because it was Easter, she got pulled from another floor. Nope. She is in fact a preceptor, which means she's the one teaching new nurses on her unit. I believe this is the exception and not the rule, but it goes to show how scary our healthcare system can be. What happens when no one is paying attention? This client is not married, no children, no close friends to advocate for her. If you or someone you know is overwhelmed with healthcare, medical bills, or insurance, please reach out. We know the system, we know the language, and we're here to support you. Happy Wednesday.